Hello, and welcome to The Art of Being Human. We've been talking about dementia, and I want to continue with that today. We're almost finished, but I still have some things I want to say about it. And my whole purpose is if you are a caregiver of a person who has Alzheimer's or some other kind of dementia, Alzheimer's is not the only kind, then I want to give you comfort and hope and some suggestions. I want to help you to understand what it's about, the different levels of dementia, what happens, what kind of research is being done. And my whole purpose of doing this whole segment on dementia is to show you what it's like and how to help you if you're living with a patient that has it, or if you've been diagnosed with it yourself. I recently saw a television show, and I've made some notes on it, and I want to make some comments on it. And the show was on a journalist, a very well-known, well-respected journalist who has been diagnosed with Alzheimer's disease. And he chronicles his changes as he goes through the process of understanding that he's got it, and as he's failing mentally and he remembers less and less and less. He's talked about it, he's written a book on it, but he was interviewed and talked about on a television show in which he talks about himself. Now, this man is a journalist. He's very brilliant. You can tell by the way he talks he's very brilliant, the way that he uses words. You know that he's very brilliant, and yet he knows that mentally he's failing because he does have it. And this is what he says about himself. He talks normally. When he is talking, he's talking normally. He can use words and phrases, and you can tell how bright he is. He understands what's going on. He has a good intellectual grasp, and then suddenly it kind of fades away. He was talking about himself to somebody. He was being interviewed, and he's talking about the changes in his mind and what he could do and what he couldn't do and what kind of a life he had ahead of him. And then he suddenly said, I can't talk anymore because my thoughts are leaving me. And so they switched to something else. They talked to his wife, they talked to his children, and so he's chronicling in this show what it is like. He cannot any longer go alone anywhere. He does run. He runs in the morning to get his mind active because he thinks it helps him to be better. But in terms of going places by himself, to manage by himself, he doesn't do that anymore. And he talks about that. I can't go anywhere by myself anymore. Somebody has to be with me, he says. The reason being that he probably wouldn't find his way back. He would get lost. How many times have you watched the news and they talk about an elderly person that's wandered away from home? Well, they probably have Alzheimer's. They went for a walk and they got lost and they couldn't find their way back. I had a client once with a brain tumor, and she could go to a store and then suddenly forget where she lived. She couldn't get back by herself. Now, fortunately, they were able to operate on that brain tumor, and she recovered, so that was no longer a problem, and she got back to normal. But if you stop to think about it, how awful it must be to see yourself decline and not be able to get back or do what you normally would do. So he goes through certain rituals in the morning to get himself up. When he wakes up in the morning, there are certain things he does that gives him structure, and that structure helps him to get back his mind back to normal enough so he knows what he's going to do for the day. Now, it doesn't necessarily last, but that's what he does. His children are grown. They're young adults, a girl and a boy, and they were interviewed too, and the boy started crying. And I'm going to guess he's early 20s or late teens. He said, the problem is I've lost my father. And then he went on, and I understand what he means. He said, if my father had died, then I would learn to live without him because he obviously wouldn't be coming back. But I've lost my father. He's losing his mind. And I have to know that my father is lost to me, and yet at the same time, I have to see him like this. You know, in divorce cases, it's also true. It's easier for a person to manage without a spouse if they die than after a divorce when they still may be living in the area, so you see them, but you're no longer connected with them, that's more difficult than just to know that they're gone and they won't be back, and you manage to live without them. But to live without them and yet have them there, that makes the problem worse. It makes the grief worse. So what the children are going through, and the wife too, is going through grief because they are losing somebody who really is still alive. Now, we've gone through the 7 stages of dementia. On the last show, I went over those. And after the last stage of dementia, then, of course, what happens is that death usually follows. So the wife notices every day that he's failing more and more. And it's not that he doesn't get up and get dressed and eat his breakfast and do a few things, but the fact is he's putting things away in wrong places. He's doing odd things, things that may make sense to him at the time but make no sense to anybody else. Now, I can remember going to meals. We had a cafeteria type arrangement where I would go to meals in the cafeteria, and I got to be close to one of the people, or quite a few of the people, but the husband of a wife had dementia and probably had Alzheimer's, was diagnosed with Alzheimer's. And what happened was, she said, he seems okay when I have him out in public. I wouldn't let him out in public alone because he would be lost, but when I have him out in public, he seems all right. But the thing is, he's doing really odd things at home, things he normally wouldn't do. And so I can see that he's failing over and over and over again. He's getting less and less able to work with it, to have a normal life. Now, this man, this journalist, who, by the way, used to write for USA Today and a number of other really top-notch newspapers and magazines, he's fairly well known, he said he has an exit strategy. In other words, he has cancer. He has testicular cancer. He does not want to die in kind of a vegetative state because of the dementia, which will get worse and worse. He knows it's taking him down. So he is not going to have the cancer treated. He's just going to live with the cancer. And if it takes him down, it takes him down. He feels that dying from cancer is probably better than living for a long period of time with dementia, with Alzheimer's, and dying at the end of those 7 stages, which can take a long time. You know, the differences, and I've said before, Alzheimer's is not the only type of dementia. And a lot of people think that all dementia is the beginning of Alzheimer's, but that's not true. There are some illnesses where dementia is a part of the illness and it progresses rapidly. But with Alzheimer's disease, it seems to start more slowly. And for the first 2 or 3 stages, people don't know there's anything wrong. They may not even know that they have it. Other people may not know that they have it. They get a little more forgetful, but the first stages will be a loss of memory. So, and that happens gradually. In some types of dementia, it's the personality that changes first, but in Alzheimer's, it's not the personality that changes first, it's the loss of memory, and that becomes more and more pronounced with time. Now, most elderly people do have some memory problems, but it doesn't mean that they have dementia. For example, you forget what you do with your keys. That's not dementia. A lot of people misplace keys and they're forever hunting for keys. But the difference is, if you have dementia, you don't know what the keys are for. If you have just normal memory loss and the brain does shrink some as a person gets older, then you've forgotten where you left your keys. Once again, you search them out, eventually you find them. And you say, I'm never going to do that again. I'm going to try to remember where I left my keys. But then once you got the keys, if you couldn't remember what they were for, what are these things? What do I do with keys anyway? I don't have any need for keys. Then there's a possibility that there would be dementia, possibly Alzheimer's disease. It's not a normal forgetting. It's a normal forgetting of what you do. There are some other interesting things about dementia. My aunt had dementia before she died. She had Alzheimer's, one of my aunts. She was one of my favorite aunts. And for a long time, we didn't even know where she was, but we finally tracked her down, and I went to see her, and she was toward the end. She couldn't talk much. And she was in a locked ward, the reason being that she would wander. A lot of dementia patients, a lot of Alzheimer's patients are in locked wards of nursing homes, and they're locked up so they won't wander away. You know, how many times have you heard in the news that somebody's wandered away and they can't find their way back? Well, and I mentioned that before, I realized. But what she used to say to me was, "You're packing your bags. You're packing your bags." And I didn't understand what she meant by that. I mean, I knew what she said, but I didn't know what she meant by that. What did that mean to her? And a nurse said, "She wants you to leave. She's telling you to pack your bags and leave." But all she can say is, "Pack your bags, pack your bags." And it wasn't too many more weeks after that she failed enough that she passed on. Well, what happens in dementia, what happens in Alzheimer's, is that a patient tends to get to a certain level that's lower than what they were before, and they stay there for a while. And when they stay there for a while, you get so used to them being at that level that it almost seems normal to you. And then after a certain number of weeks or months, they drop to a level that's below that, and then they stay at that level for a while. And once again, it seems kind of normal that they're there, although they weren't as good as the other level. And they keep dropping at different levels, staying for a while, then dropping to another level. The thing is, you can get used to that, and it's what seems normal to you is not normal to anybody in the outside world, but you're used to your loved one being functioning at a certain level, then they drop, and then they drop, and they drop again. As caregivers, people who take care of others who have dementia have a great deal of stress on them because you can't ever leave them. They can't manage themselves. They can't take care of themselves. They can't be left alone. And so the person who's the caregiver of one who is in dementia really needs a lot of help themselves because they have to be encouraged. They have to be sustained. They can't keep on this road all the time because if they do, they're just going to get so stressed out because, you know, it's difficult to care for a person who's ill to begin with, but the thing is, these people won't get well. There's no hope they're going to recover. There's no hope they're going to get better. Fortunately, there are medications that are being devised that help people to sustain themselves. In other words, they slow the progress of the disease. The progression of the disease will continue, but at a slower rate. It's not a healer, but it slows them down. And there are medical tests now that people can take if they're afraid that they're going to get dementia, and they can take these tests and it will show whether they're going to get it or not. There are certain markers that they look for, so they can be diagnosed as possibly going to get the illness before any symptoms ever show up. The advantage is that they can start being treated early for it. Now, these tests are about 60% accurate. That's probably not accurate enough for most people, but if you know that there's a 60% chance that you're going to get it, and if you take medication to forestall it, it may well be worth your doing it. And new medications are being researched all the time. There are medications out today that help to slow the progress of the disease so that a person can be normal or pretty normal for a lot longer period of time. And that's worth doing. So it's just something to consider. It is a major health crisis. 50% of the public within a few years, I don't remember what years were given, but 50% of the public in a few years are either going to have dementia, Alzheimer's probably, because 60% of the people who have dementia are Alzheimer's patients. 50% will either have it or will be caring for a person that has it. So it is a major, major health crisis. And in a few years, it could bankrupt Medicaid and Medicare. It's just a thought. Now, new tests identify the people who have it or could have it. There's a possibility of them having it. And I think those things, those research is going on. And there are some tests that are interesting. If a person has Alzheimer's or they have some kind of dementia, one of the tests that's given to them is, can they draw a clock? They'll ask them, now on mental status exams, that's pretty routine. They will ask you to draw a clock. And what are they looking for? A person who's in the throes of Alzheimer's cannot draw a clock. They can't get that circle with the numbers in it. They just can't do it. That's a dead ringer type of diagnosis that a person has dementia, probably Alzheimer's. The other thing that Alzheimer's patients do is they lose their sense of smell. They can't smell. And that's important to know that, because that's a clue also. I mean, there are other reasons for not being able to draw a clock, and there are other reasons for not being able to smell. But the two big ones is that Alzheimer's patients lose both of those abilities. So what I want to do now is to get to the charts that I have here. And I also want to mention, as I have every so often, if you do have an illness, if you have some kind of a chronic illness that involves dementia or any other chronic illness, don't beat yourself over the head with it and say, oh, it's my fault. If only I hadn't done this. If only I hadn't done that. I don't want anyone to feel that way. It does not lessen a person's worth. They're worth as much as before. They're special. They're important. And it doesn't lessen that. And you are a person, and your value is the fact that you are a person. It's not because of whether you've got a good intelligence or a low intelligence. It has nothing to do with that. So just to keep in mind that this is not an issue in terms of self-worth or self-concept, or should not be an issue. Well, let me get to these charts. What is actually happening in Alzheimer's? What happens in dementia? I want to show you these. I may not get to all of them this segment, but I'll try to get it to as many as I can. We have in our body, the brains and our nervous system, different neurotransmitters. These transmitters do a lot in terms of getting the body to kind of talk to itself, getting messages from one part of the body to the other. So the neurotransmitters, acetylcholine, norepinephrine, serotonin, dopamine, they're all reduced. And anyone who has dementia, there's a lessening of the amount of the neurotransmitters. And they have plaques. People build up plaques and tangles, and they're basically amyloid protein plaques. They're in the brain, and you get these areas that you have the plaques. And by the way, scans will see it now. It used to be that you could never diagnose a person who had Alzheimer's until after they died, and then you did an autopsy, and you would find these amyloid plaques. Well, now scans can pick it up. With that journalist, they knew exactly where his plaques were developing because they could see it on scans. But these plaques develop, and nerve cells get all tangled up with them, and then the nerve cells die because they can't function, and what happens is that you become basically disabled, mentally disabled because of that, because the neurons cannot function normally. You can get dementia from head trauma. Years after head trauma, Alzheimer's can develop, and I'm thinking basically about football injuries, which has gotten in the news lately. What do they do about people who have football injuries and they end up by having dementia years later after the injuries have occurred? And I wonder why that doesn't happen with soccer patients. I haven't read anything about soccer people who have dementia, but they bang their heads on the ball, so I don't see why the same thing doesn't happen. You have genetic factors. It seems to run in families. I'm talking about dementia here and Alzheimer's. People with Down syndrome, and I'm going to get into Down syndrome next session and explain really what's happening with that. It is a type of retardation. They carry an extra chromosome, an extra 21 chromosome, and they are very susceptible to Alzheimer's disease, believe it or not. Parts of the brain can be affected by AD, Alzheimer's disease. The frontal lobe can't reason. The parietal lobe can't orient itself to time and space like it usually does. The occipital lobe it has impaired language functioning. The temporal lobe can't recall or use words. The hippocampus is impaired and you have impaired memory. The amygdala, there's impaired emotional control, and there are also other situations and other neurotransmitters that are involved. And what I'm going to do is I'm going to skip these. These are the parts, well, maybe I shouldn't. These are the parts of the brain: the parietal lobe, the temporal lobe, the occipital lobe, the cerebellum, which is not so much involved, the frontal lobe, which does the thinking. If you think of the brain and the tangles that occur in Alzheimer's, all of the brain is affected. I could do a little more work with this, but I think I won't. You can get dementia from vascular disease. In other words, something's wrong with the blood vessels in the brain. So this is vascular dementia. The blood vessels are damaged, and so you get dementia from that. And that's the second most common cause of dementia after Alzheimer's. There's a progression of dementia. It's faster in this type of dementia, and then it may clear up and get worse again. Patients also get small strokes, and the strokes, very small strokes, if you have enough of them, they can destroy the brain, and the blood flow to the brain is interrupted. So this vascular dementia is important, almost as common as the dementia for Alzheimer's. You can get dementia due to human immunodeficiency virus. That's HIV. That's not AIDS, but it's the precursor, the beginning of HIV. Both HIV and other kinds of organisms can cause dementia. You can get dementia due to head trauma, which I mentioned before. It gives amnesia, and the head trauma gives emotional problems. It also gives impulsivity. You can get dementia due to Parkinson's. And Parkinson's, the nerve cells are lost due to the lack of dopamine. And what happens? You have tremors, rigidity, and you can get a type of dementia from Parkinson's. That's not, of course, Alzheimer's, but it's still dementia. You got to remember, some of the symptoms of dementia are the same regardless of the causative factors, but some of them are a little different too. You can't call it all Alzheimer's, even if the symptoms are somewhat similar. You can get dementia due to Huntington's disease. You get twitching, cognitive changes, depression, but that lasts for about 30 to 50 years. And then you get it between the ages of 30 and 50, but it can last for about 20 years. That's a very, very long-standing illness. And then death follows. You can get dementia due to Pick's disease, where the symptoms give personality change first and then the dementia rather than the memory loss. And I know I'm going through this quickly, but we only have 1 minute left. So I think I'll close it here, and I will continue with this next time, and we will finish this next time. So please join me then.